Hi all, my name is Tiffany Seibert-Yeakel and I'm Research and Policy Director with the Women's Fund of Omaha. We are providing a brief recorded update in lieu of our semi-regular public policy power hour. It is a busy week and weekend as we look towards primary election here in the city of Omaha, and the Women's Fund has been doing lots of work around the health education standards and the State Board of Education meeting that's happening today. So just wanted to provide a quick update via recording about what we see happening in the next week at the legislature, as well as a little bit of information about the health education standards and how you can use your voice in support of this important development for our state as well. So Friday, April 2nd, the Women's Fund will be providing public comment in support of the proposed health education standards that the Department of Education has worked with experts in education, medical providers, public health experts to develop a draft framework to guide the health education of public school students in our state. These standards will not be mandatory, but they will provide an important framework that school districts can look to and decide what elements they would like to include in their health education. These draft standards are based upon the expertise of a number of experts that have come together, as well as existing information about best practices and national standards in a variety of areas that support healthy students who can grow into healthy adults. So the Women's Fund is in support of comprehensive health standards to guide the health education of our students. We believe that youth need and deserve access to age-appropriate, medically accurate information that give them the skills and knowledge to navigate healthy relationships and safety and healthy development and grow into healthy and productive adults. So we are encouraging all of you to reach out to your State Board of Education members and express your support for age-appropriate, medically accurate health education standards. We also think it's important to name that these standards must be inclusive. They must recognize the complex identities and realities that our students bring to the classroom in an effort to create supportive learning environments where all students feel valued, heard, and supported. So we'll provide some additional information in the comments to support you as you reach out to to your State Board of Education members in your role as a parent, as a former student, and as active members of your community. If you're an educator, if you're a faith leader, if you have expertise in any of these areas that support the health of students, please weigh in and please let them know that our students need and deserve medically accurate, age-appropriate information about how to navigate their health and healthy relationships. At the legislature next week, some important bills coming up. LB 451, introduced and prioritized by Senator Terrell McKinney, will be debated, or is on the agenda at least, for Tuesday. If you haven't already, please reach out to your senator and let them know that you support LB 451, which is the bill that bans hair discrimination in the workplace. So we are hoping for some really powerful debate on the floor about the importance of this policy to creating equitable workplaces in our state. Thanks to Senator McKinney's leadership and the incredible advocacy of Ivy Black Girl, the bill LB 451 advanced from the committee without opposition, so unanimously advanced, and we hope that broad support continues all the way until LB 451 can become law and natural hair discrimination will be banned in the workplace in Nebraska. Additionally, LB 260, which was introduced and prioritized by Senator Megan Hunt, um, provides an opportunity and support for folks who may have to step away from their job to care for a loved one in the situation of a health emergency or medical condition. It would allow them to access unemployment insurance to provide some level of financial stability in that critical time when a family member needs support and care. And then lastly, LB 497, a bill introduced by Senator Wendy DeBoer and prioritized by the Speaker, would support survivors of domestic violence, sexual assault, and child abuse in receiving reimbursement for medical costs as a result of their victimization. Right now, such survivors are eligible for the Crime Victims Reparations Program, but there's a pretty extensive process that goes into actually accessing these funds. And what LB 497 would do is, with the permission of the survivor, it would allow a health provider to bill directly to the program to take care of those medical costs associated with the victimization, so that a survivor doesn't have to navigate the process of applying and submitting medical bills and waiting until they're approved and all of that. It would allow those costs to be taken care of in a more direct way that supports the financial stability of survivors. That's what we see coming next week. We have several more bills that we can anticipate in weeks to come, but just wanted to give you a quick update. And last but not least, please make sure you make your voice heard. Elections have consequences, and we want to make sure that you are weighing in and using your voice in the primary. So make sure you vote by Tuesday. So thanks.